our group will be presenting the issue of dating violence among Hispanic children and women between the ages of 13 to 24, specifically in the South Los Angeles area. So, regardless of age or gender, dating violence is a widespread problem that can affect everybody. Yet, children and women are particularly susceptible to dating violence. So, in fact, studies have shown that young women between the ages of 13 and 24, have the highest incidence of dating violence, which can really begin early as the age of 11. Unfortunately, research shows that Hispanic women in particular experience higher rates of dating violence than women in other racial or ethnic groups. This issue is especially concerning because dating violence can have long lasting effects on a person's physical and mental health, as well as their future relationships. So it's crucial that we address this issue early on and provide young people with the tools and resources they need to recognize and prevent dating violence. So, part two here, I'm going to be talking about the types of preventions linked to our program. First, we're going to be talking about the primary prevention. So, primary prevention is a crucial aspect of addressing dating violence among teens and women. By providing education and resources early on, we can really work toward preventing dating violence from occurring in the first place. And here are some examples I provided to be effective throughout our program. Education and awareness. So, providing education and awareness programs in schools and community centers and other settings can really help young people and women recognize the signs of dating violence and learn healthy relationship skills. Supportive relationships. So, encouraging healthy relationships and fostering supportive environments can really help prevent dating violence by promoting positive communications, respect, and empathy. And third, empowerment and self esteem. Building self esteem and empowering young women and children can really help them recognize their worth and make informed decisions about their relationships. Empowering Hispanic women in particular and young teens with education and resources on healthy relationships and dating violence preventions can really help prevent them from dating violence before it really occurs. Second would be the tertiary prevention. It really focuses on providing support and resources for individuals who have already experienced dating violence. So here are the lists. So the first, counseling and therapy. So offering counseling and therapy services can really help individuals process their experiences, heal from the trauma of dating violence, and develop coping strategies for moving forward. Medical services. It offers the offers included are sexual assault examinations and treatments for injuries and can help survivors of dating violence obtain the care they really need. Third, support groups. So, providing support groups can really help individuals connect with others who have had similar experiences and provide a sense of community and validation. Providing resources and support in Spanish or other languages spoken by Hispanic women and children can help break down language barriers and ensure that survivors have access to the information and assistance. So, by offering these tertiary prevention strategies, we can really help teens and women who have experienced dating violence to heal, recover, and move forward in their lives. And we always have to remember that recovery from dating violence is a process that takes time, and individuals may really need ongoing support to achieve that 100% healing and growth they really need.
Now I'll be talking about the prevalence within mortality. So there are over 1,500 deaths within the United States caused by domestic violence and about 2 deaths per 100,000 children. In 2020, it was found that about 1.3 million adolescents and adults between the ages 15 and 24 years old died, which is the equivalency of 11 deaths per 1,000 adolescents. The risk of Hispanic females experiencing dating violence were higher compared to non-Hispanic females. Now I'll be talking about the incidences of mortality. So within the general population, about 1,500 deaths per year are caused due to domestic violence. There are at least 5 million cases of domestic violence that occur annually for women who are over the age of 15 years and older, who experience domestic violence. And within the Latina population, there are about 29% of Hispanic females that experience dating violence.
Okay, so the prevalence of morbidity, according to the National Institutes of Health, approximately 1 in 3 women of 18 years of age or older experience domestic and sexual violence. This rate is approximately the same for women from other racial and ethnic communities once socioeconomic status is taken into consideration. Latina rates of intimate partner violence were lower for Mexican immigrants at 13.4% than for those of Mexican descent born in the United States at 16.7%. And a study conducted on high school Latino teenagers between the ages of 13 to 17 found that a history of childhood abuse became a large predictor of intimate partner violence for Latina emerging adults. It resulted in higher odds of Latina women ages 21 to 24 of becoming a victim of sexual intimate partner violence. And the incidence of morbidity. According for the general population, approximately 1/3 of women will be victims of abuse. 1 in 4 women will experience physical violence by their intimate partner at some point during their lifetimes. But when we focus on our target population, which are Latinas, about 1 in 3 Latinas at 34.4% will experience intimate partner violence during their lifetime. 1 in 12 Latinas, 8.6%, have experienced intimate partner violence in the previous 12 months. And lastly, low rates of reporting and self-help seeking among Latinas may make it seem that intimate partner violence services are not needed in the Latino Hispanic community, but they are definitely needed.
All right, so for the cost of treatment for dating violence, there are some economic factors and consequences that are associated with it, which include low income or low SES, unemployment, and poverty. And this shows how women are more at a disadvantage of being victims of dating violence, which leads them to needing medical attention and mental health care needs. So studies show that that on average, according to CDC, the cost of dating/ intimate partner violence over a victim's lifetime, specifically for women, totals up to $103,767. And this can include any type of violence done by their partners, such as rape, physical assault, and stalking. And overall, the total cost of dating violence can exceed up to $5.8 billion each year, with at least $4.1 billion being directly paid towards medical and mental health care needs. And lastly, women who are victims of dating violence lose at least 8 million days of work, paid work / productivity each year because of the violence done by their abusive partners. And this is due to their partners just trying to stop them from going to work themselves or going to the work unannounced and harassing them constantly.
This part, we're going to talk about the inputs for the description of our logic model. So for our inputs, basically, we're going to be working closely with our partners and stakeholders. We're going to get our staff and volunteers. We're also going to be able to see if we're going to be able to have the financial funding for our organization and get all the materials needed for our organization. So in our activities, we're going to be working with both hands-on and information and education. So we're going to be doing dating role-playing workshops, dating violence prevention course, healthy relationship education, individual and group counseling workshops, and we'll be providing resources such as pamphlets and brochures to our families. So during our activities, we just want to make sure that the women that we are helping and serving get connected to other organizations and receive the help and education that they need. And for our outputs, this is where we're going to have any post evaluation, post surveys done. And this is where we're going to see how beneficial our program was for our families and see if any other information is needed. Or any other like hands-on training and knowledge is needed.
So for our program, we have 3 measurable impact objectives. So the first one is Hispanic women and teens will increase their knowledge on dating violence by 25%, as measured at post-test through a self-administered questionnaires, question 1 through 20. The second one is Hispanic women and teens will change their behavior towards reporting dating violence by 5% as measured at the 1 year follow-up through clinical measurements from nonprofit organizations. And the last one is Hispanic women and teens will increase their knowledge on resources made available for dating violence victims by 30% as measured at post-test through a self-administered questionnaires, questions 1 through 10.